I think maybe we can start now. So, hi everyone, welcome to our Social Innovation in Health Media Training Workshop 2024. And so delighted to say each of you join us for our today's session. So before we dive into today's presentation, let me explain how to use the translation feature to ensure each of you can follow along comfortably. And first, find the caption icon at the bottom of your Zoom screen and open the translation function. And for my speaking language, you should choose English. And for my caption language, click on the icon and select your preferred language from the list. So next, I'd like to reminder each of you a few housekeeping rules to ensure a smooth and productive session. So first, please keep your microphones muted unless you are called upon to speak. And if you have any questions, just feel free to type them directly into our chat box and our team members will respond to you. And also, please use the identifiable names for yourself and avoid any generic names like iPhone 123, something like this. And also, ensure you have a good internet connection. And if this cannot be achieved, you can view the archived version later. And all of our point slides and videos will be uploaded to our website within the next 24 hours. So Zixuan will share the link of our website in the chat box, and you can visit our website for the access. And if you have any questions, just feel free to email me. So yeah, now it's my pleasure to introduce our distinguished presenters for today's session. So today, we have Dr. Jorob Jose Cruz, who is from the CHI Philippine Hub and also the CHI Secretary. And he is also one of our CHI fellows. And Dr. Jana, and she is the manager of the CHI Philippine Hub and also one of our CHI fellows. And today they will give you an introduction to human-centered design for health to help you understand the principles of the human-centered design and how to apply it to the social innovations through some like the how to apply the human-centered design to some of your social innovation activities. So yeah, so it's over to you. And thanks, Dr. Jenna and Dr. Jorob.
Hello to everyone. Let me just share my slides. All right. I hope you can see my slides clearly. And again, yeah, we would like to remind everyone to please put their microphones on mute if you would not wish to speak. But later, towards the end of this session, we will have some time for Q&A, so you can unmute then. And again, welcome and thank you everyone for joining us for another webinar of this whole mid-year training series by CHI and SESH. Again, we would like to I would like to acknowledge the members of the team with me here, Jose Cruz, Liz Chen, Wadyuto Azugo, and also with us is Kyle McKillen, who will be managing the chat and answering any of your questions. So keep them coming in the chat. And we can also participate in the different activities later through the chat. And if you were able to receive actually also the email in preparation for this session, we ask you to please prepare or at least have access to a piece of paper and pen or pens for the activity later. All right, so without further ado, let's start this session on the introduction to human-centered design for health. But before we go to the inputs or the content, we'd like to just get to know you more a little bit and also your ideas. So we would like to request you to share in the chat about, you can introduce yourself first, your name, where you're from, maybe a little bit about your work, and answer this question: why are you interested in learning about human-centered design in health? And my colleagues will monitor the chat and help me read out some of the responses. Uh, Let me give you a couple of minutes to do that, to just share your ideas in the chat. Okay, I am waiting for some responses. So, why are you interested in learning about this, or even the whole training workshop or series in SIH? So we have here already, HCD is a great way to engage local communities. Agree? Yes, thank you very much. From Joel from South Africa, says is interested to design effective alcohol and other substance abuse interventions. Thank you for sharing that and that great work that you're doing. And hopefully HCD or this session will give you some ideas on how to design your interventions with your community members and other stakeholders. Anyone else would like to share? Okay. Wow, the comments are now coming a little quicker, so I may miss some of them, but I'll try to read some. HCD is the modern innovation engaging communities. I guess we can say that also, especially in behavior change communication. It seems an attractive and effective way to understand social innovation in health. Indeed, it's one of the approaches we can use. In the public health sphere, yes, it is better to let people be part of the program designs. Indeed, we agree with that it really makes the interventions and the people more accountable when they are part of the design. So interested in engaging community members in participating to apply it in community nutrition and health interventions. Yes, a lot about getting the community perspectives and getting them engaged in their programs and interventions to raise awareness, yes, in health issues in communities. This is a good insight also that modern medicine is losing the human touch and there is a loss of physician and patient bond. So maybe insights from this can actually help. Understanding the problems from the perspectives of the community. Yes, that is really part of this process. Okay, there are really a lot of responses already. Thank you very much. I don't have time to read through all of them, but I think in summary, many of us are interested in knowing about how to genuinely engage people and communities in the different health programs so that it will result in more effective and more accountable implementation. So thank you very much, and thank you for joining us again today. Good morning, good afternoon, and good evening, depending on where you are in the world. And I hope that this will be a worthwhile session for you. So you may keep on interacting in the chat. And if you have questions, again, our colleague Kyle and other team members will be responding to those questions. So without further ado, let's jump right in. This will be the simple outline of our session. This will really just be an overview about HCD. This is not meant to be a very in-depth jump into it, but this is really meant to get you interested and to look to further resources. So what we'll do is just give a brief definition of what human-centered design is, and then we will go through some of the mindsets that a human-centered designer should have. And then we will discuss the HCD process, its different phases. And with that, we will be presenting some tools that we can use for each of the HCD phases. And that first four parts will take up around 20-30 minutes. And then the rest of the time, we will be using it to apply HCD in a certain community health challenge. And that's where more of the interaction will be. Okay. So human-centered design, according to IDEO, which is a design and innovation firm that coined actually the term design thinking, they describe or define human-centered design, or HCD, as a creative approach to problem solving that starts with the people you're designing for and ends with new solutions that are tailor-made to suit their specific needs. And also UNICEF, in their HCD for Health program, they define HCD this way, that it is a problem-solving process that again begins with understanding the human factors and the context surrounding a specific challenge. So actually, simply put, and it's in the name, in the term itself, right? That human-centered design starts with the people that you are designing for and with, and ends with solutions. Solutions that are fit for their context, fit for their experience, acceptable to them. Now, before I go on, we would just like to present to you that there are actually different variations of HCD and design thinking and some accompanying resources. And we would really encourage you to look into these. So the first one, the Field Guide to Human-Centered Design of IDEO, is really the main reference for our whole session today. And I believe that this was also part of the email that was sent to you prior to this session. So we really encourage you to look into this. As mentioned also earlier, UNICEF has its own package as well, the HCD for Health. It has different resources, slide sets, facilitators, guides, and this was actually designed for community health workers. And then, of course, we have the famous Stanford Design School design thinking process and tools. So there are 5 steps here. And finally, this came a little bit more recently, I think in 2018. The Creative Reaction Lab presented this and made also a guidebook on this equity-centered community design. So for this, they put together principles of community development, and then the approaches also and tools of design-based problem solving, and then added a focus on equitable outcomes. And they came up with this equity-centered community design. So it would also be, I think, of value to you to explore this guidebook. So going back, HCD again, it starts with the people and ends with solutions. And the types of solutions that the HCD process wants to end up with are solutions that are a combination or the intersection of these 3 things, okay? Desirability, feasibility, and viability. Of course, it will start with desirability. It has to. The solution should be something that is desirable to the people or to the community. It should be acceptable and appealing to them, something that they will actually use, something that's inviting, something that already aligns to their beliefs and their values, their existing habits, their priorities. So it really should start with that. So you want to build a solution that is desirable to the end users. But you don't stop there. You want the solution also to be feasible, of course. No, technologically and organizationally feasible. You want something that would be easy to implement, that people would actually implement, something easy to use, more or less, compared to other solutions. The technology is available for it. There are resources for it. So you have to check that as well, the feasibility. And finally, the solution also has to be viable and sustainable over time. So you have to look if it is affordable, if it actually already aligns with existing policies or programs, there is space for it, and if it is cost efficient or cost effective over time. So the whole process again of HCD aims to go and be able to design solutions that are a merge of all of these lenses, the lens of desirability, the lens of feasibility, and viability. Now let's just show some examples of the application of human-centered design in healthcare. So this is one of my favorite examples, actually. This is in a children's hospital in Pittsburgh. And the problem here was that they're having a hard time with children when they need to have this diagnostic test, no, the MRI. And as you could imagine, the MRI could be very daunting or frightening even to a child. So that's what they thought about. How might we make the experience of undergoing an MRI not frightening and even enjoyable for a child? So they tried different things, and this is what they came out with. So they thought about the perspective of the child, put themselves in the shoes of the child, and they came up with this. So they designed their test area, the MRI room, to make it look like part of a theme park, right? And painted it that way, designed it that way. And so the children would come in, and instead of being afraid, they would be curious and they would be excited and they will be more cooperative in getting the MRI. Now, in health systems, if we look at literature, we will also find that the human centered design approach has also been used already. So, these are just some examples. And with the slides that will be given to you after this, you will have the links or the references to these ones. But just to name a few, HCD has been used already to reimagine how technical assistance is given in Nigeria and the DRC. It was also used in a program to strengthen referral networks for hypertension and other NCDs in Western Kenya in the public health sector. And in the USA, the community-based participatory research combined with human-centered design was used to address violence-related health disparities, so to understand that more and address it, and mental health and well-being among Latino or Latina youth. So there are already many examples of its use in health systems. And I would surmise that after this, there will be even more applications as you would be able to do this in your own work and in your own settings. Now let's go to the HCD mindsets. Now, as a human-centered designer, IDEO proposes that there are 7 mindsets that one should have. And in the interest of time, I will just be focusing on 3 out of these 7 mindsets. So first, let's talk about empathy. And we know, no, as empathy, as it often is talked about, it's about putting yourself in the shoes of the person, trying to understand their life, their experience, looking at the problem from their own perspective. And this is really also where the notion comes in that people are actually the experts in their own lived experiences, and the people actually hold the key to solving their own problems. And empathy actually is where the whole human-centered design process is hinged on. Next is creative confidence. Now, creative confidence is the belief that anyone can actually be creative. And being creative or creativity doesn't just mean being artistic, sculpting or painting or drawing. But this is just the mindset or the perspective that the way you see the world, you can be creative about it. You can look at the problem and from different angles and try to solve it. And this also means that anyone is capable of big ideas and is also capable to take action on those ideas. So that is creative confidence, and it's very important for a human-centered designer. And finally, iterate. So human-centered designers should really adopt this iterative approach. And this means that you really take into consideration the feedback that you get from the people that you are designing for and with, and that will shape how the solution in the end will go and will evolve. So this really means that you don't have to get it perfect right away, but you're open to all of the suggestions, all of the feedback, and you do that quickly. You learn quickly, you iterate, so you get to the more successful solution quicker. All right. So these are the mindsets, and we encourage you again to look at all of them and to read about them. Now let's go to the HCD process. I think it's very easy to remember. They all the different phases. They all start in I. It's inspiration, ideation, and implementation. And again, this process is not linear. It's iterative, but also you can jump from one phase and go back to another. But simply put, it generally follows these 3 phases. So let's go through them one by one. In inspiration, that's where you start. And true to the mindset of empathy, you really start by trying to understand people, their lives. You observe them, you hear about their desires, their needs, their hopes. And then from there, you go to the ideation phase, wherein you generate ideas, as many ideas as you can at first. And then you identify the different opportunities for design. Then you create prototypes and test them. And finally, of course, in the implementation phase, you bring the design solution to life or to the market. So we'll go again through them one by one, and also present some tools that you may be able to use for each of the phases. And just to tell you at this point also that if you look at the field guide to human-centered design, there are actually lots of tools. And this is not even the only guidebook that you can find out there, but it would be really good to look through them, be familiar with different methods, and you can choose what is appropriate for your project or what you're going to do. Okay, so going back, inspiration, again, you are learning from the people you are designing for and with, the end users. You immerse yourself in their lives and understand their needs. Of course, also at the start, you build your team, you try to get smart about the challenge. And at this phase, you really talk to a variety of people, many people, in fact. So if you look at this figure as well, you see that at first it's really you're going to do divergent thinking, so you're going to get a lot of different ideas at first. So here are just some things that you can do. You can think of it as research. Actually, you can do formal research at this phase for inspiration. You can do KIIs, FGDs, but you can also do it informally. You can just talk to people, immerse again, live with them, observe their lives, talk to different experts, talk to health system actors or even multi-sectoral actors. And another thing also that you can do is what we call analogous inspiration. Now, this is trying to look for solutions in a different context, but has a similarity with your problem. So let's say, for example, your problem is in a clinic, there are long wait times. That's the feedback to you. You may want to, I guess, look at restaurants or fast food chains or other industries, other companies with clients that are also waiting, and you might want to learn their systems or how they solved their long wait times, or even just improved the wait time of the clients or the customers. And you might get inspiration from that to apply in your own context. So that's analogous inspiration, which could also help in this phase. Going to the ideation phase now. So after you have done your data gathering, you will go back together with your team. You will share with each other what you've learned. You will try to make sense of the data and now identify specific opportunities for designing and finally get to prototype some possible solutions. So at the start, you will generate lots and lots of ideas. Some of them you will have to discard, but some of them you'll keep or put together. And then, of course, you will share your prototype or your ideas with the people and again, get their feedback. So I like to summarize the ideation phase in these three sub steps. So first is synthesizing. So if you recall the figure earlier, this is now convergent thinking from divergent at first in inspiration. You now do convergent thinking, you synthesize, you download your learnings, put them together, you try to find themes. You can do formal thematic analysis if you want. You can use post-its for this, you find themes. And then from your insights or summaries of the problem, you can generate what we call how might we questions. And these are your design questions now and opportunities for design. Now, to just give some examples of that, how might we questions, let's read these. And the reference for this also is here in the slide. So for example, after their data gathering, the problem, they summarized it this way, that new parents can get overwhelmed by conflicting childcare advice, especially when they search online. And this makes them even more overwhelmed, confused, alone, and unsupported. So thinking about that, they identified these how might we questions. So the first, how might we boost the parent's mental health during the first few months of parenthood? And another one could be, how might we provide a service that makes caring for new babies feel like a team effort and make the parents feel supported? So these are some examples of how might we questions stemming from a problem. And then something also that stems from an insight. So this is now more about climate change and environment. The insight after their initial data gathering was that people that understand the impact of travel habits on the they tend to choose more sustainable transport methods when they have that. How might question, how might we show people damage a certain of transport tailor our features or apps stay are there, how might we questions when learned
Sorry, I think there may be some problems with the network and maybe some delays in the network. So please just wait for another 2 minutes and we will come back to continue the presentation. And sorry for the problem.
Thanks, Yushan. No worries. We can talk about HCD while the connection improves. Does anyone have some good HCD vignettes? I know many of you have probably used human-centered design in the context of social innovation. I think what I really like about human-centered design is that it's a structured framework, and a lot of times when funders and program people hear about social innovation, they want to see more structure and like a conceptual approach, and so that can be really useful as a tool. And Dr. Hannah, take it over.
Yes, I'm so sorry. So today it's been raining the whole day in the city where I live. So the internet has been unstable. I'm turning off my video to save on bandwidth. Can I be heard clearly again?
Yep, sound good.
Okay, thank you. Thank you, Joe. Glad to see you're here. So I think we stopped here in the how might we questions. I think I was trying to get the point across that it would be good if the how might we questions are not too broad, that you end up with a very general problem that you don't get to design a specific solution. And it also has to be not too specific, that you end up with just, one answer or a very direct solution already. Okay. So I think we lost around 5 minutes. So I'll try to breeze through this so that we can get to the activity. But again, after synthesizing your findings from the inspiration phase, the next now, and after you have your design opportunities or how might be questions, you can brainstorm now for ideas. And you can have different tools to use here, such as the journey map. And we also really recommend doing a co-creation session with different stakeholders and especially with the community members. And they proposed here also IDEO 7 rules to unlock the creative power of a brainstorming session. I will not go through all of them, but maybe just to emphasize that you really have to defer judgment at first. So any idea is okay, so that you can build on it. And it's really good to be visual. So draw, write, and at first really go for a quantity of ideas. This is just an example of a journey map. This is really good to use for a specific service because you visually plot what the client or the customer or the patient or the end user goes through and how they interface at different points of the system or the service. So for example, here, there's stages of the journey and then the specific activities that they have to do. And then you plot high points and low points in their journey, which allows you to look at the pain points and then plot also the potential opportunities for design or for improvement. And then finally, after you have synthesized, you've brainstormed on ideas, and you've chosen a few things, a few solutions, or maybe put together some ideas, you should then prototype your idea. And this can be done in different ways. You can just simply role play it at first, get to see the feel of it if it's a service, if it will actually work. You can storyboard. It doesn't have to be as nice as the sketch, but the point is for you to be able to put it visually because it will allow you to learn already a lot of things about your idea and then refine it. And finally, you can do rapid prototyping. This just means that you do your prototypes quickly and you share them immediately so that you get feedback right away and keep on learning. So whether you're doing role play or storyboards or small models or mock-ups of your idea, just do it quickly, share it, of course, test it with the people you're designing for, and so that you can get feedback right away. Yeah, so the end of it, get feedback and iterate. And finally, in the implementation phase, this is when you bring your solution to life and to the market. You build partnerships here, you refine your model, and you pilot your idea and evaluate it. And your solution will be a success as long as you keep the very people you're looking to serve at the heart of the process. You really bring them along in the whole of it. And the things that you do during implementation phase, of course, you can do live prototyping first. This is just a chance for you to run your solution for a short term, like a few days or a couple of weeks out in the real world setting. So whereas before it's just a model or a mock-up, here you're trying it out for real, but just a small scale of it. And you will have specific things that you want to test. For example, you want to just determine if how people will learn about the service. So that's what you will try to see when you do your prototype. And then again, just get feedback right away and then iterate based on that. And then the other things here, I'm sure, because most of you are already part of projects and programs, you've done these things already in implementation. You've done roadmaps, your timelines, how to do your whole project. Resource assessment, of course, where your funding is. You strategize that. You build partnerships, who can do what, and you staff your project, especially when it becomes bigger and bigger. And you keep iterating. And very important, of course, is to monitor and evaluate and keep getting feedback. All right. So at this point, I would just like again to reiterate that this is a brief overview of the whole HCD process. So this is not to make us experts on the process right away. It really needs a lot of experience and doing it. I myself, I don't consider myself an expert on this already, but we've enjoyed trying this out with communities here in the Philippines. But this session is meant to kind of whet your appetites, to get you interested, to get you looking at the resources and trying out the different tools. So what we will do, I think the best way to learn more about it, and we have, I think we have enough time, we will do a guided HCD for health activity. And we will be starting with a case vignette. And just to give a bit of a background, back in 2021, so this is drawn from our experience in a research project that we did back in 2021. So if you recall, 2021, you were still in the pandemic, and we were tasked to assess service delivery at the community level during the pandemic with all of its restrictions and its disruptions in the health system. And then after assessing that, then phase 2 of that project was to co-create what they call extended delivery models of care. So now, based on our initial phase, which was really doing desk review, key informant interviews, and focus group discussions with community members, you could say that was our inspiration phase. And this is where we draw from our data to create this story of Lito. So I would read it to you, and please just listen carefully and reflect on it. So Lito is a 24-year-old farmer with 2 children who lives in a remote island village, and it's a rural village. He was suspected to have pulmonary tuberculosis 8 months ago due to persistent coughing, and he went to the rural health unit or the health center to consult, and he was advised to have his chest x-ray done and to submit a sputum specimen. However, due to the pandemic travel restrictions and financial difficulties, he was only able to comply with both tests 2 months ago. So there was a 6-month delay, and hence only starting his regimen, his treatment last month. He goes to the village health station, or we call it barangay health stations, every week to receive his daily dose of the HRZE tablets. However, there are instances wherein the village health station has stockouts, so unable to provide sufficient medications. So he's confused because he is instructed to drink his medicines daily, but there's no stock. He's also confused about his management, and he has no means of communicating with the healthcare professionals because of the poor internet and mobile phone signal in their area. Although he really wants to ask about his management and follow updates, he also, of course, fears for his children who might contract the disease. He tried approaching their partner community health worker to ask about adverse effects, but that healthcare worker was unable to adequately respond to his questions. Also, the health center does not have regular testing of the disease also for his family, and the family could not afford to go to the town also on a regular basis to have those tests. So Lito just continues to take his medications when there is supply, despite all these, hoping that he will be cured of his disease. So this is again based on the data that we have gathered when we did this assessment of a local health system. So now we would like to ask you to reflect on Lito's situation based on the case vignette that we read, and to think about the different pain points that he and people like him in their area are experiencing regarding accessing TB care. And please share your thoughts in the chat, and the team will read them out. So we are here identifying pain points of Lito and those with similar experiences as Lito. Yeah, I see some responses now. So really the accessibility is a big problem, and they feel the threat to their family. Yes, very big medication supply issues in the local health system. What could be the other pain points, you think? Yes, there was poor communication issues, yes, with the healthcare workers, the healthcare professionals. And yes, the stress that he is experiencing can lead to mental health problems as well, transportation, communication, the stockouts, yes, and that emotional stress of the fear of infecting his children. Yeah, so there are lots of problems preventing him from getting the care that he needs, travel restrictions, financial problems, yes, no active patient support, yeah, health information also, and education, mindsets as well, socioeconomic problems. Yes, there could also be some self-stigma, all of their socioeconomic issues. The being in remote islands, they have to travel far, and that costs them a lot. Lack of access to the health workers, to health education. But yeah, it's good to note that despite all, he was trying his best to adhere to the medications, even if he has some gaps in the information, inadequate medical services, yes. And even the diagnosis was delayed and could have caused anxiety. So in general, a lack of access to health and to resources. So thank you very much for those inputs. In the interest of time, let's move forward. We would just like to share with you. So what we did in this research project in the phase 2, we did community journey mapping with local health system stakeholders and community representatives as well. And in the community journey map, that was very similar to the vignette. These are some of the pain points that were identified. So this was reflected in all of your responses. Thank you very much. So the lack of emotional support, no clear contact person for Lito, their broader concerns in their livelihoods and other priorities. So he would have to balance whether to manage his farm and his livestock, or go for healthcare. And of course, the difficulty in access in reaching the diagnostic facilities, and that transportation is really expensive or even unavailable, especially for remote islands. Okay, so now let's go to the fun part, or more fun part in HGD, in the ideation phase. And if you recall, we asked you in the email and earlier also to have access to a piece of paper. So what we're going to do, I hope my camera can now be, the internet will be able to. So you're going to fold your paper into 8 sections. So you fold it in half first, and then another half, and another half. So you will have 8 sections of your paper, and we will set a timer for 8 minutes. And what you will do in those 8 minutes is to sketch one idea each in each rectangle, rather, and then do your best within 8 minutes to fill all of the sections, all of those 8 sections. So 8 ideas, I guess, sketch 8 ideas within 8 minutes. And when the timer ends, all pens down. Okay? So let's start. I hope you have fun with this. I am not sure if we can provide some background music from my colleagues, but you may want to turn on your own Spotify. We usually search for creative music playlist, things like that, and it helps us. So we have less than 8 minutes to go.
Is the timer working, Yusha? Or it did the Manila did the internet have a problem again? Oh, there we go. Maybe it's back.
Yeah, sorry, I think it paused earlier, but it's working now, I think.
Can you flash the instructions again? There was one request to have the instructions.
Oh, sure, sure.
Thanks.
Don't worry. I'm just gonna uh time myself. So we have 6 minutes left.
We have a request in the chat to better understand the assignment. Can you just give the prompt one more time?
Can is it this one, the instructions, or specific to the case you mean?
Yep, someone said in the chat, I need to understand the assignment. So just wondering if maybe you can
Ah,
brief recap
okay.
of the design challenge.
Yeah, sure. So it's based also on the pain points identified for Dito. So it's really about improving their access to TB care in their community, which is a rural island village. So any ideas, or it's a bit broad, I understand, yeah, but that's where we can think about just different ideas first. And you have a total of 8 ideas you can put into drawing, and we have around uh 4.5 minutes left. We have 2 minutes left. Thinking about ideas, and this is a good way to do individual brainstorming first, and then after that you share it with your teammates so that you can build on each other's ideas. So what we do now is ask you if you can share your the things that you've sketched and you have done, your ideas in the chat. I know there's already a function. Yeah, I see someone already doing it. That you can take a photo and then put it in the chat, or alternatively, you can type down the ideas, your ideas for innovation and solutions. So I see here one. I'm trying to open it. Have access to regular tests, support his family, easy access to health facility. Can anyone can other people? So thank you very much for this, Lamin. Mariama is talking about, of course, empathy and doing co-creation and prototyping to improve accessibility, inclusivity, and testing. Would anyone like to add? I actually wasn't able to finish mine. Oh no, the lighting is on. I only got to 5. Yeah, 5 ideas here in my sketches. Okay, I see other people sharing financial support, education and training to improve skills. I guess it's for healthcare workers as well. Leadership, nutrition could be a part of the program. Better communications and recognition for the health workers. Yes. Any other ideas? Okay. You can keep it coming, guys. And you can. Wow, someone was able to write ideas, Jonathan, in all 8 sections. Okay. Client, and then okay. So he used the socio-ecologic model and connected ideas in 3 identified segments: mobile health for TB services, peer educators and delivery of TB drugs, community health workers. Okay. Thank you very much for sharing those ideas. And in the interest of time, I'll just move on already. But just to share with you, from our study, from what we did. So after doing community journey mapping, we actually tried to come up with a solution. So there were a series of brainstorming sessions with the local stakeholders and with the community members. And what we were able to come come up with and to prototype is a tele-referral pathway that can be of use for patients, especially follow-up patients of tuberculosis. And actually, this could also be used for NCDs like hypertension and diabetes. And it's a tele-referral pathway that in an island barangay, what we did was to use two-way radio to be able to do this. So part of it, yes, was training the community health workers on how to refer properly so that they can access the healthcare professionals right away that is in the mainland. So we even developed this acronym that they can follow so that they can do this referral more effectively. And here are just some photos of the prototyping that we were able to do in that island village with the healthcare workers. And this is just a photo of the initial training with them. So that is our one of our recent experiences of using human-centered design with a formal research at the start for inspiration, and then ideating with the community members and health stakeholders up to prototyping a certain solution. So just to wrap things up, again, you would like to remind that it's really important to iterate, and iterate. It's good to test multiple ideas. So again, for example, we did crazy eights, right? So if you in your team would be able to choose like 3 or 4 and put things together and choose 3, you can test multiple ideas. Don't converge too early. If you remember the figure, so we are diverging, converging, and then diverging again when we ideate different ideas. So don't converge too early. And then get feedback from the people, test it with them, and then iterate it with them. So I know we have just 4 minutes left, but I would like to check if there are still questions in the chat or that has been adequately answered already also by our colleagues. Thank you for sending these over, your crazy eights. It's really nice. Trainings, community engagement, I'm seeing those themes. Having a good number of contact persons, subsidizing costs, having advocacy activities, really nice sketches here as well, or connecting different ideas. Mobile health, I'm seeing that. TB care at the community level, making sure of the supply. And again, holding meetings with the community, planning how to prevent stock out. So some of these also are systems improvement, right? So sometimes you don't need to have very innovative, specific solution yet, but you can also find ways to just improve the current system. So like here, Jean Su says policy support for rural healthcare. So thank you very much all for your inputs and your remarks here in the chat as well. We will take all of these into consideration. And I also think that there's going to be a feedback form. So we would like to request you to fill that out. Thank you very much. Some people are still sending over their photos. Thank you very much for participating. And I hope this gave you ideas on what you can do with your teammates and with your stakeholders and communities. So in summary, I'm sure you already know this by heart by now, that human-centered design is a problem-solving approach that starts with the people, very important, and ends with solutions that are fit for their context and their needs. So let us adopt the human-centered mindsets, such as empathy and creative confidence. Understand the HCD process. We went through inspiration, ideation, and implementation already. We got to see some of the tools and learn how to use them. We even used some of them in our activity. So we really encourage you to learn more about them, to read up, and also to just try out the tools. And the more you use them, the more you get comfortable, and the more you get to solutions that will be acceptable to your community. So we really encourage you to use them to co-create with health stakeholders, even multi-sectoral stakeholders, and with the communities you are working with. And here are some other recommended resources. Again, the slides will be provided to you after this, so you can explore all of these wonderful resources. And even the short courses, for example, the one from Acumen Academy, I went through this, and this was very helpful for me as well to understand HCD. So we encourage you to go through these resources. And that's the end. I think it's 59 in my clock, so just one minute left. So thank you very much. Yusha or Joe, if you have any other reminders before we let them leave.
Thanks, Hannah. That was fantastic. Really well done, and I learned a lot. I think human-centered design is such an important perspective and approach, and you really did a nice job to bring it to life. So our next session will be on applying an intersectional gender lens on social innovations in health, an introductory module, and it'll be June 25th, 1 to 2 p.m. West African time, 8 to 9 p.m. in the Philippines and China, basically the same time slot. As Dr. Hannah mentioned, there's a separate, did you already share the link, Hannah, for your evaluation?
I think Yusha shared it earlier, but maybe
Okay.
we would need to share it again.
Okay. Yeah, if you could put that into the chat box. Yeah. And then as usual, the website will have more details. It'll have the PowerPoint presentation, the archived version of the talk will be there within 24 hours or so, and I'll put the link into the chat box again. But thanks again, Hannah. That was excellent. And Joe.
Thank you, everyone. See you again in the next sessions.